Warrami. My name is Madison Shakespeare and I proudly identify as a Gadigal saltwater woman from the east coast of Australia. I'm an early researcher and wanted to share with you today some different approaches through which to assess primary healthcare policies. These policies are specific to Australia and I harness decolonising methodologies through which to conduct this research. This research that I was involved in was part of a much bigger project called Decolonising Practice in Aboriginal and Torres Strait Islander Primary Health Care. I thank my colleagues who are listed on this screen for their support, their guidance, mentoring me through these processes. And I thank you all for being here and listening today. I note that this recording was made across Ghana and Pamarak country. And I'd like to acknowledge traditional owners, elders and ancestors across all of Australia where we work, we learn and we more deeply engage in truth-telling, which is part of what this project contains. I note that all of the opinions, the comments and the assessments within this presentation are solely mine unless they are attributed specifically to other people. Today I'm going to speak to you about aspects of the framework for searching, selection criteria and search terms used in this policy analysis. We're going to have a very brief glance at policies that were selected, and I'll also outline some aspects of the decolonising approach that underpins this policy analysis, where we look at some of the methods and methodologies that have been employed. The framework for searching that was relied upon is the framework that was expounded in the publication of November 2021 on the right-hand side. So criteria for document selection is to look at publicly available websites of all health departments across Australia, state, territory and federal government. Looking at those websites, searching them for current strategic policy documents that address specifically Aboriginal and Torres Strait Islander health. To be considered strategic policy, the documents needed to meet the following criteria. They had to be a departmental document describing a policy or plan, strategy, framework, guide or equivalent, and incorporating guiding principles, goals and strategies or equivalent for action in an area of departmental responsibility related specifically to Aboriginal and Torres Strait Islander health. My colleagues also decided upon using the Australian Indigenous Health InfoNet database as the first database that would be searched. So accordingly, I went in search of national jurisdictional Aboriginal and Torres Strait Islander specific health policies using this database. When first searching the term policy, there are a plethora of documents that came to light. In fact, 317 documents described as policy type documents and 52 policy documents. I wanted to refine that search even further. So inserting the word health, searched health policy. I note that both of those searches, policy and health policy, were done in inverted commas to be very specific. And this indeed did delineate the search further and identified 39 policy type documents and 7 policy documents. So when looking more specifically at the refined search term health policy, I found the following 7 identified policies. But as you can see, that they're quite old. I mean, the most recent is 2010. This didn't deter me. I wanted to go in and see what all of the links led me to, and indeed did this. And it was a very worthwhile process in many respects because it gave me background in terms of where things were at and where things are moving toward
in more contemporary contexts. Wanting to ensure that I accounted for multiple policies, I conducted a further search and changed the search terms to health policies. And as you can see, I didn't directly discover any specific policy documents under the way in which the search results delineated. Here, however, I certainly did discover some exceptional documents about Indigenous health policies. The thesis, to begin with, that's listed as the first result, was really insightful in terms of theoretical considerations. However, I went beyond this document because I wanted to find more specific policy documents rather than just discourse and discussion about theoretical considerations. I note that there may be 2 journal articles there that may have names that are familiar to you. Well, I thought that this was an excellent search result because 2 of the 5 certainly link back to Flinders. But all that aside, the other documents in terms of the 2012 National Health Policies and Strategies link and even the report of 2005 were really insightful, and these provided additional leads that I then went and did considerably more extensive research in regard to. The last search that I conducted on the Australian Indigenous Health InfoNet database came up with an older resource of 2012. When exploring this link further, I was redirected to a federal Department of Health website. And this was a really pivotal moment, certainly in terms of the pathways that I pursued in identifying future documents. Despite the age of this website, there were links and there was discussion about different aspects of aims and intentions of health policies with a focus on cultural competency. And there was also discussion links to aspects of closing the gap. So from this point, I then went on and conducted more extensive searches and found the Commonwealth Closing the Gap Implementation Plan of 2021. I then sought to more expansively search for health policies specific to First Nations peoples of Australia that were more contemporaneous. And here are some examples of some of the websites that I used to identify these policies. Now looking at what documents could be included and those that were excluded. So long as a document was dated in terms of date of publishing from 2006 onwards, it could potentially be included. However, if for some reason this document was a formal guideline about processes for gaining specific permissions and or primarily describing the sale, use or development of products, services or assessment and or evaluation of assessment procedures, it was excluded. This means that there was a broad range of documents that could be included in my policy analysis. I've tried to provide examples across that broad range. So some are very specific to place-based considerations, and others are considerably more expansive in what they consider. Over the next 2 slides, you'll find a table that contains the policies that have been selected, coded and analysed. You'll find a column on the left-hand side that specifies their jurisdiction, so where they're from, if they're federal, state or territory, and indeed numbers them. There is one policy at the top, Closing the Gap Commonwealth Implementation Plan of 2021, that has become a standalone policy in many respects. Whilst it's included in the national policies, this document is a really significant operational document. It's become almost a quasi-yardstick in my analyses. Today, because of the lack of time, I will not unfortunately be able to provide you with extensive findings and observations made in my analyses of all policies. However, I will be able to provide you with a modelled example of how I've searched specific terms and found them to be realised in contexts of the first policy, so the NAT-CTG. Once processes of selection criteria, framework for searching search terms had been engaged and policies decided upon, I then needed to determine how I was going to search for components, elements, and thematic concerns contained within our 10 domains. To be very specific, I wanted to define the domains that were used and the exact wording of those domains as at most recent revision of them, which at the moment is August 2021. So these terms contained within the domains were used as foundationary search terms and considerations in this policy analysis. Now we come to method that I used when looking for and trying to identify the most appropriate terms to search. So I went back to a domain focus and individually looked at each one of the domains and its intention. So looking at my aims here, if I'm going to ensure a domain-focused approach, I needed to select word or word combinations that most closely aligned with thematic and cultural sentiment contained within each domain. So to give you an example, if we look at domain 2, which states employment of Aboriginal Torres Strait Islander staff, then I engaged in a kind of brainstorming activity that considered the aspects of staff employment, what could come from employing staff, what was wanted. Why would we have this domain and what are we seeking from this domain? So I went toward outcomes like capacity building and building community capacity, prioritising employment, looking at developing and ensuring culturally safe work environments, and indeed prioritising training and looking specifically perhaps at aspects of our workforce and, for instance, came up with Aboriginal cultural workers as a search term. Wanting to be very specific in terms of delineating even further searches involving the multiplicity of considerations there, you can see I've categorised and labelled each domain. So, for instance, domain 2, it's D2.1 for capacity building, D2.2 for building community capacity, and you can see that there's scope there now to be able to differentiate between capacity building of individuals, but also building community capacity, which goes back to realising ways in which community is perceived, seen, valued, prioritised in our ways of knowing. So I've tried to include the space or the scope to realise differentiated ways of knowing, doing and being, actually within these individual domains through being able to identify the scope through search terms and terminology. Humbly, I consider that this is a really useful and even potentially powerful way of redressing systems that don't account for such difference in terms of perception of community, for instance. So this within itself is a decolonising method. and underpins decolonising, or certainly contributes toward decolonising methodologies. By being able to use a method that provides the space in which to realise differences in our perception, in terms of differences between how First Nations peoples perceive contexts and realise outcomes, we need to be able to ensure that there are words included in policies that articulate what we need to realise to achieve these outcomes. So, for instance, Domain 5, if we're looking at ways of working to strengthen cultural identity integrity, yes, we're going to look across policies for words like self-determination, which is D5.1, but that's only the starting point. We need to look more specifically at operational inclusions like data governance arrangements, that's D5.2, and even more specifically at First Nation peoples protecting knowledges and practice by ensuring that this protection is included, articulated about in policy. So D5.3, data sovereignty. So you can see how the further delineation, the subsections within the domains, provide space in which to actually realise First Nation perspectives, First Nation people's ways of perceiving contexts, our worldview or views, but also we are able to see, when we consider these specificities and search for these specific terms and considerations, we're able to see if strategic actions that are embedded in the policies specific to us and our outcomes, if those strategic actions are actually focused on the outcomes that we seek and that we require to ensure that we do realise our own self-determination and we do protect our knowledges and practices and we do realise holistic health and wellbeing outcomes. Looking at domain intentions and outcomes sought from domains and finding search terms that are relevant and associated with those intentions and outcomes can become part of a specific decolonising approach. So when we're looking, for instance, at Domain 9, addressing racism within the organisation and challenging racism in other organisations, then certainly racism stands out as that first search term. But associated with that is colonisation, indeed racism being a byproduct of colonisation, and bullying, exclusion. I've also included social determinants of Indigenous health in there and social determinants of health more generally, to do general searches on those and then be able to differentiate to see if policies do differentiate between the two. But I've also included health advocacy. So looking at what is needed to actually proactively address the detriment that comes from colonisation, which indeed in that domain is the focus. So you can see how in that context all of those search terms really focus on a proactive way of identifying if policies that are contemporary really realise the inherent systemic nature of colonisation and its byproducts. Because if they don't consider these components, then how can they possibly offer solutions that are strategic in their decolonising approach or approaches? Search terms selected considered linguistic elements of the domains and their thematic focus. There were occasions when further revision of search terms occurred. These additional searches have been annotated and highlighted in yellow. There are occasions across the domains where there may be shared considerations. So, for instance, self-determination arises in domain 5.1 and also features in domain 7.1. My coding accounts for this and still maintains specificity of count according to the specific domains, but identifying these shared components is also very useful, because what it means is that nexus and points of intersection between the domains can be commented on. I'd now like to specifically discuss how I've used a particular methodology in this policy analysis that focuses on different priority reform areas of the National CTG Policy 2021 and then reverberates and is realised in specific policies that have been reviewed in this analysis. So if we look at Priority Reform Area 3, for instance, target decreasing the proportion of Aboriginal and Torres Strait Islander people who experience racism, we then go across to the right-hand column that's annotated in green. Then our National Cultural Respect Framework for Aboriginal and Torres Strait Islander Health Policy of 2016 to 2026 focuses on aspects of addressing this target area. Similarly, if you look at Outcome 14, Aboriginal and Torres Strait Islander people enjoy high levels of social and emotional wellbeing. We look at National Framework for Continuous Quality Improvement in Primary Healthcare for Aboriginal and Torres Strait Islander people, 2018 to 2023. Target 14, significant sustained reduction in suicide of Aboriginal and Torres Strait Islander people towards zero. Then we look across at our National Strategic Framework for Aboriginal and Torres Strait Islander people's mental health and social and emotional wellbeing, 2017 to 2023. So you can see that in this table, there are parallels drawn between outcomes sought and policies that have been analysed. Similarly, on this slide, you'll see a correlation between Priority Reform Area 2, which is building the community-controlled sector, and the Birthing on Country Framework Policy that was analysed. What is of significance later in the analyses that I've undertaken has been correlations between the priority reform areas and the outcome areas of this national CTG plan and the 10 domains. This is an example of how my searches were conducted. You'll see with domain 1, I have a number of different search terms that I put into NVivo. Putting those search terms into NVivo and cross-referencing them against each policy then came up with a number of different results, and those results are detailed on the right-hand side in the larger column. Conducting coding and assessment of policies based on valuable cultural thematic considerations that are contained within the domain harness a decolonising lens through which to peruse and assess the extent to which these considerations are realised and reflected in the policy documents. Conducting a narrative review by harnessing words that are specifically meaningful
to our Indigenous epistemologies and ontologies, ensures that we're searching through policies and assessing them in terms of considerations, practices that are relevant and meaningful for First Nations peoples. Being involved in research that is focused on cultural interface methodologies is of benefit for all who are involved. There is great reciprocity to be realised, for I bring with me my specific cultural knowledges and practices and those of my kin and community, as does every other researcher. I interpret the word community, for instance, as can be seen in Domain 6. I interpret that word perhaps in a very different way to my non-Indigenous allies. Having the ability to share our different perceptions and our different understandings is significant. When looking at policy documents, it's interesting to see the conundrums that arise when words that are used about First Nations peoples and about our well-being are words that we would use, perhaps, and understand in different ways. An example of how search method informs on narratives construed around considerations of culture. This method supported discovery of the frequency of the use of search terms that may be associated with our defined domains, and provided opportunity to assess if key narrative and thematic considerations of each domain correlate with ways in which policies used and understood the same and similar words. For instance, when looking at Domain 3, there is a disproportionately higher occurrence of words from this domain identified across policies rather than any other domain. I sought to better understand whether the frequent use of the word safe across all policies referred to more general contexts of safe practice, processes or procedures, or was it specific to cultural considerations? I considered that identifying an explicit correlation between the words cultural safety and safe important, as this not only prioritises intentions in policies that seek to promote operational contexts and strategic actions focused on Indigenous cultures, but may inherently reflect policy approaches that redress detriment caused by colonisation. The health policies reviewed focus on achieving better health outcomes for Australia's First Peoples. My searches clearly identify use of the word safe correlating to cultural safety. This explicit nexus between cultural safety and safe is necessary to achieve holistic well-being for all First Nation communities. And looking more specifically at decolonising methods and methodologies used in this research project, I'd like to look at the fact that we've analysed Australian and Indigenous specific health policies through elements that are contained within the 10 domains. This is a decolonising method, as all domains are focused on addressing aspects of colonisation, achieving equitable, safe and culturally focused outcomes that facilitate self-determination for Australia's First Nation peoples. Designing a research project that is specific to policies intended to improve the health and wellbeing outcomes of Australia's First Nation peoples. And then further analysis of the most recent federal Closing the Gap Commonwealth Implementation Plan of 2021, where I focused on this document as an operational document that shows policy intention and strategic actions. Identifying contexts in policies where word use infers intention to address, redress and or overcome colonisation, colonising practice and social determinants of Indigenous health. And using search terms that explicitly seek to identify word use in policies that reflect thematic considerations relevant and meaningful
to First Nation peoples and our historical, social, economic experiences and our cultural, communal, relational and spiritual epistemologies and ontologies. This prioritises Indigenous cultural knowledge and practice. Using cultural interface research practice that involves yarning to share different perspectives of Indigenous and non-Indigenous researchers, through which to evolve new knowledge and practice.